Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a GP talking to a patient called Alice. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Alice. How can I help you today?
Hello, Doctor. I've been feeling really unwell for the last few weeks. I'm not sure what's going on, but it's been getting worse.
I'm sorry to hear that. Why don't you tell me a bit more about what's been happening?
Well, I've been feeling extremely tired, and I've lost my appetite. I thought it might be a stomach bug at first, but then I started feeling nauseous and dizzy, and now my skin's starting to get red and irritated in patches. I'm really worried.
That sounds difficult, Alice. Have you experienced any other symptoms, like a fever or bleeding?
Yes, actually. I've had a low-grade fever for a couple of days, and I noticed some bruising that doesn't seem to go away.
I see. And how long has this been going on?
It's been about 2 weeks now, maybe a bit longer.
Thanks for sharing that. I'll need to ask a few questions to get a clearer picture of what might be happening. Have you been exposed to any chemicals, radiation, or unusual environments recently?
I actually work in a laboratory setting, and I handle various types of equipment and substances. I'm always careful with protective gear, but about 3 weeks ago, I was accidentally exposed to a small amount of radiation during a malfunction with one of the machines. They told me it wasn't enough to be dangerous, though.
Understood. Even small exposures can sometimes affect people differently. It's possible that your symptoms could be related to radiation exposure, especially given the timeline. Radiation sickness, also known as acute radiation syndrome, can develop after exposure to high doses of radiation, but even lower doses over time can sometimes lead to symptoms if you're sensitive.
I've read about radiation sickness before, but I didn't think it would happen at such a low level. Is it common?
It's not common at low doses, but sensitivity can vary. Generally, people exposed to low levels might experience mild symptoms, but the combination of nausea, fatigue, skin changes, and bruising suggests your body may have reacted more strongly than expected. Let's go over some tests that can give us more information.
So what kind of tests would we need to do?
To start, I'd like to order blood tests to check your red and white blood cell counts as well as platelets. Radiation exposure can lower these cell counts, which would explain the fatigue, bruising, and possibly even the fever. I'll also order liver and kidney function tests to see if your organs have been affected.
And if my cell counts are low, does that mean it's definitely from the radiation?
Not necessarily, but it would be a strong indicator, especially with your recent history of exposure. We may also look at markers of inflammation to see if there's an underlying response from the body. If the blood results suggest radiation effects, we might refer you to a hematologist who specializes in radiation exposure.
I see. Is there anything I can do to start feeling better in the meantime?
Resting is important, and eating small, nutrient-dense meals might help with the nausea and give your body the energy it needs to recover. Staying hydrated is essential too. However, the treatment options can depend on the results of these tests, so I'd like to wait before recommending anything more specific.
And if it is radiation sickness, is it serious? Will I get better?
If this is radiation sickness, your symptoms could improve on their own, especially if it was a low-level exposure. Severe cases often require more intervention, but with proper care, people do recover. The focus would be on supporting your body's healing, managing symptoms, and monitoring cell counts closely.
That makes sense. I'm really hoping it's something mild.
I understand. I'll make sure we get these tests done today, so we can review the results soon. Let's set up a follow-up appointment early next week to go over what we find. Does that work for you?
Yes, that should be fine. Thank you for explaining everything.
Of course, Alice. We'll do our best to get to the bottom of this. I'll see you next week, and in the meantime, please reach out if you experience any new or worsening symptoms.
I will. Thank you again, Doctor.
Extract 2. Questions 13 to 24. You hear a doctor talking to a patient called Mrs. Sia. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mrs. Sia. I understand you came to the clinic because you've been experiencing some health issues over the past couple of weeks. Can you share a bit about what's been going on?
Yes, Doctor. I started feeling unusually tired about 2 weeks ago. At first I thought it was just work stress, but then I noticed some other symptoms too.
I see. Can you tell me more about these other symptoms?
Sure. I've been feeling nauseous, and my appetite has really decreased. I've also had a slight fever, but I figured it would go away on its own. Then I noticed that my eyes and skin started looking a bit yellow, which really worried me.
I understand, and I can see why you'd be concerned. The yellowing of the skin and eyes, also known as jaundice, can indeed be a sign of liver issues. You mentioned feeling tired and experiencing nausea. These are also symptoms that could be associated with a liver condition. Have you noticed any changes in your urine or stool color?
Yes, actually. My urine has been much darker than usual, and my stool has become kind of pale, which seemed odd.
Thank you for sharing these details, Mrs. Sia. Based on your symptoms, it's possible that you may have hepatitis A liver infection caused by the hepatitis A virus. This infection can lead to symptoms like fatigue, nausea, jaundice, dark urine, and pale stool. We'll need to do a blood test to confirm this, as that's the most accurate way to diagnose hepatitis A.
I see. How could I have gotten hepatitis A?
Hepatitis A is usually transmitted through consuming food or water that's been contaminated with the virus, often due to poor hygiene or sanitation. Have you recently traveled to a region where hepatitis A is more common, or eaten any food that might have been prepared under less sanitary conditions?
I did travel about a month ago to an area where I wasn't sure about the water safety. I tried to be careful, but maybe I slipped up somewhere.
It's very possible that you might have been exposed to the virus during your trip. It can sometimes take 2 to 6 weeks for symptoms to appear after exposure. The good news is that hepatitis A often resolves on its own without causing long-term liver damage, especially with supportive care.
That's a relief to hear. What kind of care would I need?
For hepatitis A, treatment typically focuses on relieving symptoms and supporting your recovery while the virus runs its course. Rest is very important since fatigue is common, and you should avoid alcohol or any substances that could strain your liver. Staying hydrated and eating a balanced diet can also help manage nausea and maintain your energy.
Okay, I can do that. Will I need any medications?
There aren't specific antiviral medications for hepatitis A, but we can provide supportive treatments to help with nausea or pain if needed. Also, we'll monitor your liver function to make sure everything is on track. Most people recover within a few weeks to a few months.
That makes sense. I'm glad it's not a long-term thing, but is hepatitis contagious? Do I need to take any precautions with my family?
Yes, hepatitis A is contagious, especially during the first few weeks of symptoms. It's spread through contact with infected fecal matter, so practicing good hygiene is essential. Washing your hands thoroughly after using the bathroom and before preparing food will be important to avoid spreading it to others. Your family members may also want to get vaccinated, as the hepatitis A vaccine is highly effective at preventing infection.
Good to know. I'll be careful. Is there anything I can do to prevent getting hepatitis A in the future?
Yes, absolutely. The best prevention is vaccination, which is recommended for people who travel frequently or may be exposed to unsanitary food or water. If you haven't been vaccinated, we can discuss getting you started on that once you've fully recovered. Also, being cautious with food and water safety, especially when traveling, can reduce your risk.
That sounds like a good idea. I'd like to avoid this again if I can.
I understand. Let's get that blood test done today, and once we confirm the diagnosis, we'll set up a care plan. In the meantime, focus on rest, hydration, and gentle foods to help your liver recover.
Thank you, Doctor. I appreciate all the information and the reassurance.
You're welcome, Mrs. Sear. I'm here to support you through this, and we'll work together to get you feeling better soon. Please don't hesitate to reach out if you have any questions.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a doctor talking to a colleague. Now read the question.
Hello, Dr. Smith. Do you have a moment? I'd like your advice on a patient of mine.
Sure, go ahead. Tell me about your patient.
I have a 50-year-old man with slightly elevated cholesterol. He has no history of cardiovascular events, but he does have a family history of heart disease and a few risk factors, like mild hypertension. He's asking if he should start statins, and I'm considering it, but I'm not sure if it's warranted yet.
Current guidelines suggest that statin therapy can be beneficial for patients with elevated cholesterol and additional risk factors, especially when there's a family history of heart disease. So if your patient is open to it, initiating statins may indeed help reduce his risk.
Now look at question 26. You hear a member talking about an agenda. Now read the question.
Us more about this issue.
Yes, certainly. As we've all been noticing, the surgery department is experiencing frequent delays and cancellations of procedures. This is mainly due to an overbooked schedule, as we're trying to accommodate a large volume of surgeries without enough time or resources. For example, the operating rooms are often fully booked, and there's limited availability of surgical teams. As a result, patients who are scheduled for surgery often face cancellations or delays, leading to dissatisfaction and repeated rescheduling. This not only affects the patient's health but also strains our resources further when they have to be rescheduled, creating a cycle of continuous backlog.
Now look at question 27. You hear a medical professional explaining or talking about a patient. Now read the question.
We have Ms. Julia Roberts,
a 35-year-old woman who underwent surgery for a fractured femur yesterday afternoon. The operation went smoothly, and she's now in a full leg cast. Her post-op observations are stable, her temperature is 36.8 degrees Celsius, and her blood pressure is 128/76. She's been managing her pain well with minimal analgesia, only requiring a mild dose overnight. She's able to wiggle her toes, and capillary refill time is normal. I've already scheduled her follow-up X-ray in 3 days. She's being educated on cast care and the importance of keeping it dry. Before discharge tomorrow, she'll need a printed follow-up plan. Could you make sure she gets that, please? I've also left notes for the physiotherapy team to check in with her later.
Now look at question 28. You hear an anaesthetist discussing potential risks with a patient before her upcoming surgery. Now read the question.
So, Mrs. Thompson, before we proceed to the theatre, do you have any questions or concerns about the procedure?
Yes, actually, I do. I've been thinking about what you mentioned earlier, and it's making me anxious. I know you said the chances are minimal, but what about reactions to the anesthesia? I've heard about rare cases where people have complications, like nerve damage or severe allergic reactions. How do you manage such situations? It's a bit frightening to consider, even though I trust the team here.
It's completely natural to feel this way before surgery. We take every precaution and have comprehensive monitoring to quickly respond to any issues. Safety is our top priority, and we'll be with you every step of the way to ensure everything goes smoothly.
Thank you for explaining that. It's reassuring to know that measures are in place, even though I'm still a bit worried about the unexpected. Now look at question 29. You hear are two colleagues taking to each other. Now read the question.
Did you see the recent article about patient-reported outcome measures for visual impairments after a stroke?
Yes, I found it interesting that there's such a variety of PROMs used to assess visual function and quality of life in stroke patients.
Honestly, I feel like we could have identified the gaps in PROMs for post-stroke vision issues without a whole systematic review.
Well, you need comprehensive evidence to enhance treatment approaches. This review provides a solid foundation to push for better PROMs specific to vision impairment post-stroke.
It certainly makes a strong case for developing more targeted PROMs. If they were more reliable, it would improve assessments and interventions for these patients.
Absolutely.
I only wish the article went into more detail on which PROMs are currently the most effective.
There's a reference to the full study in the journal, so you could always look it up for more specifics.
Now look at question 30. You hear an intern asking a senior doctor a question after a training session. Now read the question.
About the treatment protocol you discussed in today's training session. Do you have a minute?
Of course. Was there anything unclear about the recommendations for managing seasonal allergies?
Not exactly the recommendations themselves. I understand that you suggested antihistamines as the first-line treatment over corticosteroid nasal sprays. But I was wondering, why is that? Isn't it true that nasal sprays can provide more direct symptom relief?
That's a good question. The reason we start with antihistamines is that they target histamine release, which is a primary cause of the symptoms in seasonal allergies. Antihistamines often act faster, with fewer side effects when used regularly at the start of allergy season, which is why they're typically recommended first.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42nd, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview with Dr. Evan Pierce. You now have 90 seconds to read questions.
Today, we're discussing chronic back pain with Dr. Evan Pierce, a pain management specialist with extensive experience in treating patients suffering from this often debilitating condition. Dr. Pierce, could you tell us what chronic back pain is and why it's so prevalent?
Certainly. Chronic back pain is generally defined as pain that persists for 12 weeks or longer, even after an initial injury or underlying cause has been treated. It's one of the most common reasons people seek medical care, partly due to lifestyle factors such as prolonged sitting, poor posture, or lack of exercise, which place added strain on the spine. But for many, back pain is a result of degenerative conditions like osteoarthritis or intervertebral disc degeneration, both of which become more common with age. My interest in chronic pain management has grown over the years as I've witnessed its impact on my patients' lives. The daily discomfort and loss of mobility can feel overwhelming, and the emotional toll often compounds the physical suffering, creating a complex cycle of pain.
How does chronic back pain affect a patient's mental health?
The psychological impact of chronic back pain is significant. Take, for example, a recent patient of mine named Sarah. She's a mother of 2 and a primary school teacher who first came to me a few years ago with persistent back pain that hadn't improved despite various treatments. She found herself unable to engage in activities she enjoyed, like hiking with her family, and struggled to perform her duties at work. This led to a sense of isolation and a gradual decline in her mental well-being. In cases like Sarah's, chronic pain can lead to anxiety, depression, and a sense of helplessness. The lack of a definitive cure can exacerbate these feelings, as patients feel trapped in a cycle of unending discomfort.
What's the most challenging aspect for patients living with chronic back pain?
I'd say it's the impact on everyday functionality. Chronic back pain doesn't just interfere with a person's ability to perform physical tasks. It can also make basic movements, like getting out of bed or standing up, exhausting and painful. For Sarah, simple tasks around the house became a source of dread, and over time, that level of pain and frustration began to chip away at her self-esteem. Many patients report a feeling of loss, of who they once were, and this sense of loss can be very challenging to accept and adjust to. Additionally, the constant worry about triggering pain episodes can severely limit their daily activities, preventing them from living a normal life.
What treatment options are available for chronic back pain?
Over the years, we've seen a lot of progress in treating chronic back pain. There's no single solution that works for everyone, but several approaches are proving helpful. Medications such as anti-inflammatories and muscle relaxants can help to some extent, and there's growing interest in minimally invasive procedures like nerve blocks or spinal cord stimulation. For many, however, physical therapy and lifestyle modifications are the mainstays of treatment. I recently worked with Sarah to create a tailored exercise program to strengthen her core and improve her posture. We also discussed mindfulness practices, which have been shown to help with pain management. In combination, these methods have allowed her to manage her pain more effectively, although it's still a work in progress.
Do patients often discuss the emotional burden of their pain with you?
They do, but it's often after several consultations. Initially, many patients adopt a stoic approach, downplaying the extent of their suffering. Sarah, for instance, only opened up after a few months of treatment when I allocated extra time specifically for emotional support. Like many, she initially felt reluctant to discuss her mental health because she saw her pain as a physical problem alone. However, chronic pain is as much an emotional experience as it is a physical one. When patients feel free to talk about the stress, frustration, and depression associated with their condition, it often helps them feel more in control and less alone.
So, Dr. Pierce, are there preventative steps that people can take to avoid chronic back pain?
Absolutely. Maintaining a healthy weight and engaging in regular physical activity, particularly exercises that strengthen the core, can help prevent the kind of spinal strain that leads to chronic back pain. Another essential factor is ergonomics. Many people spend hours each day sitting at a desk, often in poor postures that put undue pressure on the lower back. I encourage patients to invest in ergonomic chairs and take frequent breaks to stretch and move. For individuals already experiencing mild discomfort, early intervention is key. Addressing minor aches before they worsen is one of the best ways to avoid the long-term effects of chronic back pain.
Thank you, Dr. Pierce, for sharing your insights with us today.
Extract 2. Questions 37 to 42. You hear Mrs. Rebecca Hudson, a clinical dietitian, addressing about weight loss journey. Now, read the questions. You now have 90 seconds to read questions.
Hello, my name's Rebecca Hudson, and I'm a clinical dietitian here at the hospital. Today I'll be addressing a topic that's often overlooked but critical when supporting patients in their weight loss journey: the psychological and emotional challenges involved. A patient's ability to lose weight is affected not just by diet and exercise, but by their mental and emotional resilience as well. Patients are often overwhelmed by feelings of self-doubt, frustration, and even hopelessness, particularly if past attempts at weight loss haven't been successful. It's essential that we, as healthcare providers, understand these mental challenges and provide our patients with strategies to maintain resilience and motivation. Without this support, patients may struggle to make lasting changes, and they may feel isolated in their journey. A key part of our role is helping patients find personal meaning and purpose in their goals, which can enhance their motivation. One of the first steps in helping patients overcome psychological barriers is to create a supportive and open environment where they feel comfortable discussing their fears, setbacks, and successes. For many patients, the act of talking about their weight can be distressing. To minimize discomfort, I encourage using phrases like working toward a healthier lifestyle rather than losing weight. This language can be much more encouraging and less judgmental, helping patients focus on positive aspects of the journey. Patients often face recurring mental barriers, such as comparing themselves to others, feeling embarrassed about their appearance, or focusing too much on the scale. When these issues arise, I found it helpful to shift the focus towards setting small, achievable goals. This approach emphasizes progress rather than perfection, helping patients view each step forward as a success rather than seeing only the endpoint. For example, instead of aiming for immediate weight loss, patients might aim to gradually increase daily physical activity, drink more water, or prepare healthy meals more often. Encouraging patients to maintain self-compassion is another crucial strategy. Many individuals are far too hard on themselves, feeling as though they've failed if they have a setback. We should remind our patients that setbacks are part of the process, and that what matters is their response to these challenges. Self-compassion allows them to view setbacks as opportunities to learn, rather than as failures. For instance, if a patient has a week where they didn't exercise as planned, they could focus on what they did accomplish and use that to set more realistic goals for the following week. One method I frequently use is called motivational reframing. This technique involves helping patients reframe challenges as opportunities to grow. For instance, if a patient expresses disappointment after a small weight gain, I might say, "This is a chance to look at how you're managing stress and see if there's room for improvement in ways that aren't related to weight." By reframing challenges, patients learn to view obstacles as part of their journey, rather than as roadblocks. Motivation tends to fluctuate, so it's important to recognize that patients will go through different phases in their weight loss journey. At times they may feel highly motivated, while at others, they may lose sight of their goals. During these times, I find it helpful to connect the motivation back to personal reasons for losing weight. It could be wanting to have more energy for their family, reducing the risk of chronic illness, or even feeling more confident. Personalizing the motivation helps patients stay grounded in their why. Another effective approach is to encourage patients to celebrate small victories. Many patients tend to overlook their progress if it doesn't align with their initial expectations. Celebrating milestones like consistently preparing healthy meals, achieving a daily step goal, or feeling more energized after physical activity can reinforce positive behaviors and boost morale. I often recommend that patients keep a journal or log their achievements as a tangible reminder of their progress. Lastly, continuous support and encouragement are essential. Patients need to know that setbacks are normal and that change takes time. Our role is not just to guide them, but to cheer them on and remind them that their efforts, no matter how small, are worthwhile. Educating patients on strategies for building resilience, such as practicing mindfulness, seeking support from friends or family, and focusing on small, actionable steps, can make a significant difference in their journey.
That is the end of Part C. You now have 2 minutes to check your answers.